Today, we're talking about Ergomar Tablet, Sublingual. This medication is used to treat or prevent a certain type of headache, such as migraine headaches and cluster headaches. It helps narrow widened blood vessels in the head, which reduces the throbbing effects of vascular headaches. It's important to take this medication as prescribed by your doctor. Usually, it's taken at the first sign of a headache. Make sure to follow the dosage instructions carefully and do not exceed the recommended amount. Remember to consult your doctor for the best time to take this medication. To take Ergomar Tablet, Sublingual, simply place one tablet under your tongue and let it dissolve as directed by your doctor. Avoid chewing or swallowing the tablet, and refrain from eating or drinking while it dissolves. The dosage of this medication depends on your medical condition and how your body responds to the therapy. It works best when taken at the first signs of a headache. Waiting until the headache worsens may reduce the effectiveness of the medication. Usually, this medication should only be taken as needed and is not intended for long-term daily use. The maximum dose is 3 tablets within a 24-hour period and 5 tablets within a 7-day period. If you abruptly stop using this medication, you may experience withdrawal symptoms such as rebound headaches. To prevent this, your doctor may gradually reduce your dose. Withdrawal is more likely if you have used ergotamine for a long time or in high doses, so consult your doctor if you experience withdrawal symptoms. Using migraine medications on 10 or more days per month may actually worsen your headaches. Do not exceed the recommended usage and inform your doctor if you need to use this medication more often, if it is not working as well, or if your headaches worsen. If you experience nausea, vomiting, or dizziness while taking Ergomar Tablet, Sublingual, be sure to notify your doctor or pharmacist. Remember, this medication has been prescribed to you because its benefits outweigh the risk of side effects for you. Most people do not experience serious side effects when taking this medication. However, it's important to contact your doctor immediately if you experience any of the following: irregular heartbeat, tingling or pain in the fingers or toes, muscle pain or weakness, severe abdominal or lower back pain, or signs of kidney problems. Seek medical help right away if you experience chest pain, vision changes, confusion, or trouble speaking. While serious allergic reactions are rare, seek immediate medical attention if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. Remember, this is not a complete list of potential side effects. If you notice any other effects, be sure to contact your doctor or pharmacist promptly. Ergomar Tablet, Sublingual can rarely cause a serious lack of blood flow to the hands and feet or to the brain, which could lead to a stroke. This risk is higher when taking this medication with other drugs that can affect the removal of ergotamine from your body. Examples include certain antifungals, antidepressants, macrolide antibiotics, HIV protease inhibitors, and SSRIs, among others. It is important to take Ergomar Tablet, Sublingual as directed by your doctor. This medication is used to treat migraines and should be taken at the first sign of a migraine headache. The usual dosage is 1 to 2 tablets at the start of a migraine, with another tablet every 30 minutes if needed. Be sure to follow your doctor's instructions for the best timing and dosage for you. Before taking Ergomar Tablet, Sublingual, it's important to let your doctor or pharmacist know if you have any allergies to ergotamine or other similar medications. This product may contain ingredients that can cause allergic reactions, so it's best to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have conditions such as blood circulation disease, high blood pressure, heart or blood vessel disease, liver or kidney disease, severe infection, severe itching, or if you smoke or use tobacco. This medication can make you dizzy, and using alcohol or marijuana can make this dizziness worse. It's best to avoid driving or operating machinery until you know how this medication affects you. Limiting alcoholic beverages is also recommended. Using tobacco or nicotine products while taking this medication can increase the risk of serious side effects such as heart problems and decreased blood flow. It's important to talk to your doctor about how to stop smoking if you are a smoker. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Ergomar Tablet, Sublingual should not be used during pregnancy as it may harm the unborn baby. It's important to discuss reliable forms of birth control with your doctor if you are of childbearing age. If you become pregnant while taking this medication, inform your doctor immediately. This medication may pass into breast milk and could have negative effects on a nursing infant. Breastfeeding is not recommended while using this medication, so it's best to consult your doctor before breastfeeding. It's important to be aware of how Ergomar Tablet, Sublingual may interact with other medications you are taking. This includes prescription and non-prescription drugs, as well as herbal products. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor first. If you are also taking triptan migraine drugs, such as sumatriptan or rizatriptan, it's important to separate your doses of these drugs from your dose of Ergomar Tablet, Sublingual to reduce the risk of serious side effects. Ask your doctor how long you should wait between doses. Some products may contain ingredients that could increase your heart rate or blood pressure. Be sure to inform your pharmacist about all the products you are using, and ask for guidance on how to use them safely, especially cough and cold products, diet aids, or other migraine medications. If someone has taken too much Ergomar Tablet and is showing symptoms such as passing out or having trouble breathing, it's important to call for medical help immediately. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe dizziness or drowsiness, loss of feeling in the fingers or toes, a rapid or weak heartbeat, and bluish hands or feet. If you or someone you know is experiencing any of these symptoms, seek medical help right away. Remember, it's important not to share this medication with others. Certain foods, beverages, and food additives, like red wine, cheese, chocolate, monosodium glutamate, and alcohol, as well as lifestyle patterns such as irregular eating or sleeping habits and stress, can trigger migraine headaches. Avoiding these triggers may help decrease the frequency of your migraines. Make sure to consult your doctor for more details on how to manage your migraines. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next one at your regular time. Don't take double the dose to make up for the missed one. It is important to store Ergomar Tablet, Sublingual at room temperature, away from light and heat. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not dispose of this medication by flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.